Hi, Madeline Lowry, nutritional therapy practitioner and MAP method practitioner. I want to answer some frequently asked questions about the MAP method. So, the first question that I often get is about the sessions themselves. There is no specific equipment that we use for MAP sessions. Sessions are conducted over video conference, so you just need a laptop or a device that will allow you to participate in a Zoom video conference, but otherwise, no additional equipment is needed. So the way the method works is that each client is initiated to the method. And this consists of watching a 15-minute video. So when you sign up for your first introductory session, you'll receive a link to a video, 15 minutes. You watch it before you come to the first session. Then about 15 or 20 minutes of that introductory session is spent completing the initiation to the MAP method. By the end of that initiation process, your subconscious mind is now primed to respond to the instructions provided by a MAP practitioner. And so you're ready to go. So the types of topics I recommend for a first session would be an anxiety, a phobia, or like a stress of the week. And this will allow you to experience the MAP method the way it was, what it was originally created for, which was to neutralize painful or negative emotions associated with trauma memories or painful memories. So now I want to talk about the difference between that, using the MAP method to work with emotional issues, and using the MAP method for physical symptoms. When we use the MAP method for physical symptoms, the process is more indirect, right? In the first case, we have you hold an emotional memory in your mind and rate the intensity of the emotions, which will be high when you first come in, right? 7, 8, 9, 10. And then as we go through rounds of treatment, we'll be checking in and seeing where the emotional intensity is at that point. So it'll start to come down. It may go back up again, or it may continue to go down, but by the end of the session, the goal is to have it be at a 0, 1, or 2, right? So low. But when we work on a physical symptom, we don't work on the symptom itself, right? This is not a treatment, but this is a method of alleviating conscious and subconscious sources of stress that contribute to physical symptoms or experiences of things like chronic fatigue, chronic pain. And so when we're working with physical symptoms, as I was saying, the process is more indirect. So we'll work through a set of sessions, and through that set of sessions, we'll be trying to clear stresses that you may know about or that you may not know about, but the subconscious mind brings forward as a root cause. And so after any particular session, right, the symptom may or may not be improved. It might be improved somewhat, and then it might get, return to its original level a few days later, or it may subside altogether and then reappear. It may, in some cases, I would say less than 5% of cases, the symptom may actually get worse. Because sometimes when we start to stir the pot around these unconsciously held emotions or memories, that can start to exacerbate the symptom. Usually for a day or two. If it lasts longer, I suggest that you come back and have another session. But the process, so the symptoms may wax and wane through the process, but the process is essentially removing conscious and unconscious sources of stress until you get to a point where that symptom subsides permanently for good, right? And so the concept is that, that we operate with some conscious and subconscious stressors that, as they accumulate, start to exceed some kind of threshold level. You can, if you can imagine that. And when it overflows that threshold, that's when symptoms start to arise. And so through a set of MAP sessions, we're seeking to reduce that overall total load of stressors on the body, such that the body can return to its state of health. So just, I want to make sure that people really understand that, so that they aren't thrown for a loop if they feel like the symptoms are kind of, going up and down. It's not a linear path back to health. It's more of a little bit of a waxing and waning process. For complex patterns, for long-standing symptoms, we just have to be patient as we peel back layer after layer and finally get to a point where that symptom is finally alleviated. So now I want to address the issue of, do I need to work on the same subject at all of my sessions? And the answer is no. Very often people come to work on subject A, and then that gets better, and they come back and they say, well, that used to be my priority, but my priority this week is actually B. And then maybe the third session, they'll want to go back to what they worked on in the first session, or maybe there'll be some other topic. Whatever your priority is at the time of the session, that is what we will work on. So what I want you to understand is that every session is additive. So this process of clearing stressors, both conscious and unconscious, is a cumulative process. At each session, we'll be clearing, right, certain stressors. So no matter what the topic is, again, we're lowering the total load of stress. Now, for people that are concerned, do I have to know what the cause is? Do I have to know what the traumas were that contributed to this symptom showing up in my life? So this is where the MAP method is actually very powerful. You do not need to know the causes or the connections. Some people do come, they've been doing lots of work, they've been in therapy, they want to know, or they have a list, and they say, I think that, these things have been contributing to the symptom that I'm experiencing. But for people that have no idea, the MAP method itself will uncover what the causes are and what the connections are. We don't need to know. In many cases, there's no way for us to know, because this is all held in the subconscious mind, which is not accessible to our conscious mind. The next thing I want to address is, how does the MAP method compare to things like therapy, EMDR, tapping, and what I think of as basic neural retraining methods like the Sarno method or DNRS? And I would say that there are really two aspects to the MAP method that really distinguish it from any of those other methods. For one thing, we're working with the conscious as well as the subconscious mind, right? So with the MAP method, we can create a rapport with the subconscious mind, and we can harness the power of the subconscious mind. And so that allows us that gives us access to the whole library of unconsciously held memories, subconscious programming, right? Subconscious stressors. That's what makes it much more powerful than other methods, which are just working with consciously known memories, consciously known stressors. Second thing is, like I was describing before, the MAP method, although we focus it on the one emotional or painful memory that you want to work on, it's using that memory as kind of a template or a model. And we're giving the subconscious mind an instruction or instructions to go and look for all associated memories, so all similar memories, and to neutralize all of them at the same time. So the MAP method is working with batches of memories, groups of memories, clusters of memories, and not just one memory at a time, which is, again, what makes it so powerful and so fast. Now, to answer the question, what is the role of the practitioner in session and what is the role of a client? Please understand that the practitioner is not rewiring your brain. The practitioner is more of a facilitator. It offers instruction to the subconscious mind, your subconscious mind, and your subconscious mind rewires itself. There is no rewiring that is done against your will or in opposition to your goals, right? Because you come to the session with a subject, we turn the subject into a goal statement, and that is what organizes the whole session. So the subconscious mind is working towards your goal. And therefore, as I said, no rewiring is done that would be in opposition to that goal or against your own will, because you're doing it, it's happening within your own brain. So I just want to make sure that that is very clear. Remember, this is not hypnosis. So it's not like the practitioner is providing suggestions to your subconscious mind. It is really about providing instructions to your subconscious mind so that it can do the rewiring itself in your best interests. So I just want to finish here by saying, the method is very gentle. It really doesn't require much from the client. You just come with your subject. If there's a memory associated with it, then we'll ask you to hold that in your mind. If it's a very painful memory, we'll just have you hold whatever aspect, small aspect of it you want to hold in your mind. And you just need to listen and relax. Most people spend the whole session with their eyes closed. It's a very relaxing process. So you just listen and relax, and the instructions you're hearing them, but there's nothing you have to do about them. You don't have to analyze. You don't have to do anything with those instructions. They're not for your conscious mind. They go directly to your subconscious mind, and your subconscious mind does the work. And that's it. So this is why it's so effective and so gentle. It's useful, very useful for children, for teenagers, for people who are very debilitated and couldn't travel to have another type of therapy done. It's really effective for all of those situations. So I invite you to try it for yourself. Sign up for the 60-minute introductory session. And that first session will give you a very good idea of how this all works and whether you see applications for this method in your own life. Thanks for listening.